monoxide poisoning. Carbon monoxide poisoning from Ministry of Health Pocket Manual Emergency, Saudi Arabia Ministry of Health. Overview. At room temperature, carbon monoxide is gas that is odorless, tasteless, and not irritating. Carbon monoxide impairs the oxygen delivery and peripheral utilization, causing cellular hypoxia. Carbon monoxide binds to hemoglobin with affinity more than 200 times that of oxygen after rapidly diffusing across the pulmonary capillary membrane, forming carboxyhemoglobin, carboxyhemoglobin, resulting in leftward shifting of normal oxyhemoglobin dissociation curve, which reduces tissue oxygen delivery. So, the carbon monoxide poisoning. At room temperature, the carbon monoxide is a gas that is odorless, tasteless, and not irritating. Carbon monoxide impairs oxygen delivery and peripheral utilization, causing cellular hypoxia. Carbon monoxide binds to hemoglobin with an affinity more than 200 times that of oxygen after rapidly diffusing across pulmonary capillary membrane, forming carboxyhemoglobin, resulting in leftward shifting of the normal oxyhemoglobin dissociation curve, which reduces tissue oxygen delivery. Clinical presentation history. Question to ask include: where was the patient found and under what circumstance? Was there clear evidence of carbon monoxide exposure? Was there loss of consciousness? Evidence of trauma? Was a finger stick glucose determination performed? Was non-invasive co-oximetry performed? Was pre-hospital ECG performed? Was there evidence of attempted self-harm or suicidal intent? The physical examination, trauma, neurologic and cardiovascular examination, oropharynx for edema and salts. Neck should be carefully examined for the presence of stridor, cardiac wheezing or crackles in the lung, significant myocardial depression secondary to smoke inhalation. The differential diagnosis: acute respiratory distress syndrome, alcohol toxicity, altitude illness, cluster headache, cyanide poisoning, depression, PKA, encephalitis, gastroenteritis, hypoglycemia, hypothyroidism, labyrinthitis, lactic acidosis, meningitis, methylglobinemia, migraine, smoke inhalation, tension headache, alcohol toxicity, narcotic toxicity. The workup for oximetry, carboxyhemoglobin testing in ABG, cardiac biomarker, lactate, pregnancy test, toxicological test if there is congestion, chest X-ray, CT, and ECG. The management pre-hospital recognize the potential for carbon monoxide poisoning, examination of the sense for evidence of combustion or abnormal odors or fumes, IV catheter, empiric treatment with oxygen during transport is recommended. In hospital care, sign of end organ dysfunction and carboxyhemoglobin level significant elevated. Treat with normobaric oxygen, 100% oxygen. Discuss hyperbaric oxygen treatment with chamber staff. This position, patient did not have loss of consciousness, complete recovery from any symptoms. Check the level has returned to normal, no evidence of end organ damage, as ECG changes, elevated cardiac biomarkers, neurological defects may be safely discharged to home. Patient with end organ toxicity will require hospitalization with or without the therapy, HPO therapy. Alert for severe headache, dizziness, mental confusion, nausea, fainting, pregnancy.